Meeting's called to order. Tonight, prior to our traditional pledge and moment of silence, I do want to, I have a special recognition, and it's one that I share with great sadness. Our community is quite sad tonight, and has been through the weekend, to announce the passing of one of our most loved and respected employees, Dave Hauser. And Dave has always been known to have that wonderful smile on his face, and he's been an integral part of our community for many, many years. And I just wanted to acknowledge that prior to our pledge, and certainly followed by a moment of silence. And our deepest sympathy goes out to his family and loved ones. So with that said, all those that'd like to join us in the pledge and moment of silence. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible. Thank you, everyone. Okay, Terry, roll call, please.
Mrs. Edmeades. Mrs. Fish.
Here.
Dr. Katachu.
Here.
Mrs. Gordon.
Here.
Mr. Gordon.
Here.
Dr. Gursky. Mr. Kirsch.
Here.
Mr. Reichard.
Here.
Mr. Huron.
Here. Thank you, everyone. Second order of business tonight is the meeting minutes from the August 3rd, 2021 board meeting. Do I have a motion to approve said board minutes?
I'll make that motion.
I'll second
Thank you. Thank you. All in favor, aye.
Aye.
All opposed, no. Okay, thank you. Motion carries. Okay, board administrative announcements. I will pass that on. Well, no, Columbia Montour. The only thing to report for the team in Columbia Montour is they're in the same place as other school district, which is making the final preparation plans and moving forward with the plans to initiate the school year. CSIU, Dr. Katachu, do you have anything to share tonight?
We did not have any meetings since last meeting we had here. Next one is tomorrow at 7 p.m.
Okay, thank you. And then the Finance Committee, Mr. Kirsch.
I was unable to attend, but Mrs. Fish is going to give us an
Oh,
update.
wonderful. Okay, thank you. Mrs. Fish?
Yeah, so at the Finance Committee, we discussed the middle school parking lot and the need to repair it as we move forward. The athletic band and field trip transportation, we reviewed the failed RFP and we re-advertised. Transportation personnel, tax collection and payment. We talked about how our collection has been going, as well as the 3 townships that are still under tax collectors. We talked about transferring a building secretary and what that would mean to the budget. The Riverside sale is complete, and we have a check deposited. We talked about the capital reserve and the bonds, and we're going to hear more about the bonds tonight. And we talked about the Ironman Foundation. This is a foundation that Dr. Boyle's working to put together that allows community members to contribute financially to the district through contributions. And it's not taxpayer dollars, so that allows us to supplement some things within the district. And that was all. Oh, we talked about, talked about the tuition rates for the 21-22 school year for the charter schools.
Wonderful, thank you. Athletic Committee, Mr. Gordon?
Yes, we had an athletic committee meeting last evening. We have 259 student athletes who started their fall sports yesterday. They're all registered on Family ID, and we're looking for a very successful fall season from all our athletic teams.
Wonderful, thank you.
Yeah.
And then Dr. Katachu, Curriculum Committee, anything tonight?
So, yeah, we had a meeting. We discussed career pathway issues. There were 2 information sessions that were held on July 6th and August 3rd. We invite parents to get involved in future meetings, which will be scheduled this fall. We're also working with high school staff on the rollout of this moving into the 22-23 school year. In addition to that, we also discussed ways of how the school can assist students and their parents how to achieve their goal in terms of the post-high school careers. Many parents would like to know how their kid, they want to go to a certain specialty, what they need to know, what their children need to do, 9th, 10th, 11th grade, and all those things. So there's a way that we'll go into details in the coming few months, but this is a preliminary discussion we had at the time. We also discussed about the topics of grading practices, especially for those completing high school, and procedures will be important discussion as part of this process. So, and, also the SEL curriculum is moving forward at each building, which will be discussed tonight.
Thank you. Okay, next order of business tonight is superintendent's reports. I'll turn it over to Dr. Boyle.
Good evening, everyone. The enrollment report for the district is we are having an increase in numbers. This week we had several students come in. At this time, there are 2,173 students enrolled full-time in the district. We are working diligently to call parents and work to have students who are in outside cyber schools either return to in-person or to the Ironman Cyber Academy. So that's all working in our favor. We will have 129 students at the Columbia Montour area of VOTEC. And so, you know, we're looking forward to a really good year. I also want to let you know that on Saturday, the student SCM group held a carnival for suicide prevention awareness and mental health awareness. They raised money, which I have a student coming a little bit later. Our students do so many things. She's at soccer practice right now, so once she comes, she can tell you a little bit more about it. And the other item that I want to discuss is the reopening and the COVID-19 health and safety plan. So making the final decisions related to the preventative practices and procedures related to opening schools during the stage of the pandemic has been extremely difficult. Last August, Governor Wolf provided clear mandates and guidelines. This year, the only recommendations from the CDC and the Pennsylvania Department of Health are left to the decisions are all left to the individual districts. So a great deal of time has been spent. I've attended webinars with Geisinger, the Department of Health, with PASA, which is the Pennsylvania Association for Superintendents and Administrators, and others, as well as gathering the most current data and meeting as an administrative team to discuss how to proceed. Danville Area School District is committed to opening on August 24th. Jeff, I think you can change it. For all students who want to attend, in-person traditional setting. The most recent information that we have from the Pennsylvania Department of Health that aligns with the recommendations of the CDC and the PDE, which is Pennsylvania Department of Education, focus on in-person learning with layered prevention strategies as a harm reduction framework model. The recommendations from the Department of Health and PDE are that the schools follow the CDC's and the American Academy of Pediatrics school guidance to the greatest extent possible. So please understand that this is the information I have at this time. With changes in conditions, preventative measures may change, but this safety plan is under regular review. At this time, Danville will implement the following preventative measures as layer of mitigation. So one of the first things we would like parents and teachers to do, and all staff for that matter, is to take the first step at home in screening, looking at yourself, your child, as to what symptoms, what exposure you may have, what your temperature is. If you pass screening, come to work, come to school. If you fail, I really am asking strongly that students are kept home. Notify the school, and then follow the return to school work protocols when the symptoms are no longer there. Once you've had your child tested, if you feel that's appropriate. Sometimes it's just a sniffle and a cough, but we don't know that immediately. So that's something that we're really asking, is that people are diligent in keeping their children home from school when they are sick, and the same goes for our staff. If they come to school with symptoms, we'll then have them go to the nurse, and the nurse will check them, do their screening. They will be masked and isolated if they are found to have symptoms that we are concerned about, and you'll be called to have the child sent home. If they pass, they'll just go back to the classroom and life goes on. The other layers that we have are physical distancing. One of the changes that has been made this year is it's 3 to 6 feet or the greatest extent possible with layered protection. Some of our layered protections include our cafeterias. We're going to minimize physical distancing as much as possible. They have been told that they can go ahead and serve as they have been. The restrictions having only single item and single item food is no longer in place. Cleaning, we're going to do what we've done all through this pandemic. We follow the guidance from the CDC on cleaning and disinfecting the schools. We schedule cleaning for the high-touch areas, such as door handles, the high traffic areas, those kind of things. That happens throughout the day. It's kind of a routine that's happening with the custodians throughout the day. We've looked at ventilation and with the air filters. Mr. Burkich has a good program happening, and we'll continue with that so that we can provide circulation to the best of our ability when possible. And of course, we use the electrostatic sprayer with the high-quality disinfectant at least weekly. More often, if we seem to have a case or two in a classroom, we'll go ahead and use it in that classroom that day. Hand washing, respiratory etiquette will continue. All staff and students are going to practice hand washing. We just go through that with the students, and we have sanitizer in place. In our primary building, we have bathrooms in our classrooms that students can use soap and water. Diagnostic screening is something that the state is now offering as a program, so we're asking students and staff to do their part with self-screening, as I had said. We also have a program for screening testing resources. So what I'm going to do is meet with the nurses, our certified nurses here at Danville, and discuss this screening process and the testing resources that are available to determine exactly how we want to move forward with that. We also, every Friday morning, I'm looking at the community transition levels, but in all honesty, every day I'm looking at various things on the data between the COVID updates from CDC and the Department of Health. So it's a regular thing that's happening. Okay. One of the big questions is always masks and face coverings. Universal masking is recommended for all teachers, staff, students, and visitors, regardless of vaccination status, when indoor, unless medical or developmental conditions prohibit the use. We strongly encourage each family to review the CDC recommendations to make their own determination concerning masks based on what is best for your student and your family. CDC has issued the following quarantine exception for kindergarten through 12th grade indoor classroom settings. This is for students only, not for the adults. A close contact excludes students who are within 3 to 6 feet of the infected student if both students are wearing their masks correctly and it's a well-fitting mask. So that's a important piece, because that's going to diminish the need to quarantine students. Masks are mandated on school buses. As they walk on, they need to have their masks on. It stays on until they walk off the bus. And that's regardless of vaccination status per a CDC order. So that is a mandate. Given the lack of mandate from the governor or the Department of Health require mask wearing, requiring daily mask wearing in our buildings is not feasibly enforceable. Keep going. So close contact is when someone who is within 6 feet of a person diagnosed with COVID-19 for a total of 15 minutes cumulative over a 24-hour period. That basically it deals with the adults, because we have the exception for the students. Now, if they're on masks, then this follows that. And then the exception I just told you a few minutes ago is there for the actual students. Now, here is what the process after close contact. So this involves what would happen with if we have a student or an adult who is identified with having an exposure. So regardless of vaccination, any person with a new or unexplained symptom of COVID-19 needs to be tested. Masking in all cases if there's a known exposure. If we know there's an exposure, people are going to have to wear their masks. Persons who have tested positive for COVID within the past 3 months and recovered do not have to quarantine or get tested again as long as they don't have any symptoms. And in all cases, we will be collaborating with the state health department. If a person is unvaccinated, if a close contact, the person is to quarantine for 14 days if they have symptoms. The quarantine can be after day 7 if the test, which is done after day 5, so day 5 or 6 really, results is negative and no symptoms were reported during the daily monitoring. Or quarantine can end after day 10 without testing if no symptoms have been reported during the daily monitoring. However, there is a recommendation that symptom monitoring continue through day 14. So a person could come back to the school on day 10, but they still should be checking every morning, and if they get any symptoms, they need to stay home. Now, for a person that's fully vaccinated, you can see how this is getting very complicated and confusing, so I'm trying to put it all together as simply as I can for you. Okay, if you're fully vaccinated, again, you should have COVID-19 testing, but that should be within 2 to 5 days after exposure. Let me not get ahead of myself. So people who are fully vaccinated do not need to quarantine after contact with someone who had COVID-19 unless they have symptoms or a positive test. If there's a known exposure to someone with suspected or confirmed COVID-19, the person should be tested 2 to 5 days after the exposure, regardless of whether they have symptoms. If the test is positive, they need to isolate, okay? Or if they develop symptoms while they're monitoring themselves, they can then quarantine. But we can, again, back to the day 7, can end after day 7 if you have a negative test that was administered day 5 or later. Continue to monitor for the symptoms for the full 14 days, all right, regardless of test results. We always want to continue to monitor. And then wear a mask indoors in public for 14 days following exposure or until their test result is negative. So in that case, a person will have to wear their mask for the full 14 days in the school buildings. What I wanted to do is a little bit of information for you. In Montour County, here's the cases, the new cases and the 7-day average of new cases from August 7th through 16th. So as you can see, we had one day that had a fairly significant number on the 11th of 4 people. But since then, it's been, 4 people total in 5 days. So our numbers are not that high. But because we're such a small county, it does go by a percentage of 100,000 population. So they multiply our numbers in a 7-day period by about 5.5. So they really increase what it looks like we have. In our local information, Montour County now has 70% of their population fully vaccinated and 4.1% partially vaccinated. And that's the same chart I put in the previous one. And then the IU region, there are 17 school districts and 3 career technology school programs. So the masking plans in all these districts, there are 15 school districts and all 3 career technical schools are offering optional or voluntary masking, recommending, but it's still a voluntary thing. It's not required. There are 2 districts that have some requirement status. One has that students age 11 and under are required, and another one has a change to required depending on the rate of transmission. So that's the information for the local area. So there's Danville. And I want to acknowledge that emotions are running high in the community regarding masking and receiving the vaccine. Danville Area School District will do our part by following the recommendations by layering the multiple strategies to keep the school safe to help mitigate the spread of COVID-19. With screening, ventilation, mask wearing, hand washing, respiratory etiquette, staying home when sick and getting tested, contact tracing as required, cleaning and disinfectant are all important layers of prevention. That will be practiced to keep the students and staff at Danville Area School District very safe. Thank you.
Okay, thank you, Dr. Boyle. Okay, next order of business tonight is the first of our 2 public comment periods. First public comment period is focused on agenda items only. If you care to make a public comment, our standard practice is to state your name when you come forward, and you'll have 3 minutes to share your public comment. Name and address. So with that said, offer up opportunity for public comment at this time on agenda items.
How's everybody doing? My name's Richard Brown. I stay at 50 Persetta Drive here in Danville. I have 4 kids here in the district. Well, my daughter just graduated in 2020. I have twin boys at the middle school. My son's at the high school. I just wanted to say that throughout this process of everything, your evaluations with what you want to do with the masking, my particular view, I think that masks should be mandatory. I know everybody might not agree with me, but on the other hand, emotions aren't going to help if we get out of control, because our kids need us to pull together and work as a team. The other thing is, this pandemic is just going to keep cycling and cycling until everybody gets vaccinated the way they should. You have people coming from overseas that are influx in this state or this country, and it's just going to progress. I mean, the only thing we can do right now, really, I think, is do the maximum of our benefit, and that's to have kids put masks on, just like we did last year when we were in the midst and the beginnings of this. No one wants to see that. I don't want the school to close down or my kids to be at home. I want our kids to play football and do everything they want to do. I'm just saying, I hope we can work together and come to the conclusion that we all need to that's best for our children.
Thank you. Anybody else? Is that on? Can we hear?
I think so.
Is it on now? I'm sorry, excuse me for that. Yeah, I just want to make sure we can hear you.
I was just short, sorry.
That's okay.
My name is Molly Need. I live at 10 Aaron Drive here in Danville and have 3 children in the district. I would echo what the gentleman just said, and I would encourage us to think about requiring masks. Specifically, kind of 2 things I think are important to think about. The first one is that if students are all masked and properly masked and 3 feet apart, the CDC's recommendations are that they do not have to be quarantined. And so as a community, our administrators would not have to spend time contact tracing. Families would not have to take time off of work because their children need to quarantine, and school could stay open. If masking is optional, the only way children don't have to quarantine is if both parties are masked. We will now have teachers having to track which children are masked, which children are unmasked. We also do not have a bridge program this year, so I'm concerned when children are quarantined, how they'll actually access their academics. So I'd be interested in the plan for that. Additionally, I'd like us to at least think about our unvaccinated population, so children under 12 don't have the opportunity to protect themselves with a vaccine at this time. So I would encourage us to think about at least masking in places where a child has no other form of protection.
I'm sorry, I'm going to cut in 1 second. Can you get closer to the mic? They can't hear you in cyber world.
Okay. So my last point was just that I think we should consider masking at least in buildings where our children are under the age of 12, because at this point in time, they don't have access to a vaccine, so the mask is literally their only form of protection. Once those vaccines become available, I think the district could reevaluate that in those schools. Thank you for your time. I know this is a difficult decision.
Thank you. Anybody else? Oh, yes.
Hi, good evening. My name is Mary Williams. I live at 93 Oak Street. I have one son in the district. He will be going into the 10th grade this year. I first would like to say thank you to the board and to the administration. You guys have all worked tirelessly and diligently, voluntarily through this entire pandemic, and I cannot express enough thanks to all of you. You have done an outstanding job. You have seen us through this pandemic. You have made very difficult decisions, and you're continuing to make difficult decisions. I would like to say that this plan that you have laid out is cohesive, coherent, and on point. I appreciate you leaving it up to us parents to decide if we want our children to be masked in school. I personally am completely for the optional program. I notice that a lot of you are masked and you're sitting amongst us unmasked. So at some point, you do feel the masks work. So if your unmasked, if your masked student is sitting next to my masked student, there should not be any fear that your student is going to be endangered by my son or any other unmasked student, correct? Well, not everybody is vaccinated. We've all been out of town. We all go to the grocery store. We all go to CVS, and people are unmasked. No.
One person at a time.
Thank you. So with that being said, again, I would just like to say thank you to you all, and thank you for this well thought out plan.
Thank you.
Bonnie Breyer, I live at 209 Woodhill Road. I would like to thank the few administrators and board members who wore a mask, because the CDC does recommend it inside whether you're vaccinated or not. And considering the number of leadership in this district who chose not to make that decision, I'm very disappointed. I think that we should be encouraging our children. And if my children's principal won't wear a mask in this setting, how do I explain to my kid that they should? So again, in your thing, nothing was talked about what happens when you get sent home quarantined. And we all know it's going to happen. It happened before, and last year there was at least that bridge option, so you felt, whether it was good or not, you had some coherence in your education. I don't know what the plan is at for this year. Last year, I was not comfortable with the school's plan. I picked the district cyber option. I don't want to do that to my children again, because it was not done well. I think that if we're making a decision, we should make it based on what the CDC is not recommending, not what they are requiring. And since they are recommending, vaccinated or not, everyone should be wearing a mask indoors, it doesn't seem like such a stretch that the district would say, we're going to follow the medical advice. And it is the medical advice of Geisinger, because every doctor there and every nurse is required to wear a mask in that building, and all of their patients are. So I don't know who's saying it should be optional. I do find it really disconcerting that so many people here who are the leadership didn't wear a mask, because whether you're vaccinated or not, that is the recommendation indoors.
Thank you.
Hello, I am Claire Lawrence, and I live at 229 Woodhill Road. And I also agree with the kudos to the board, the superintendent, the teachers, the administration who've gone through this year. It has been awful in all kinds of ways. And I can say that because I'm an educator. I'm a professor at Bloomsburg University, and I've done all of the different kinds of hybrid teaching. But I do just have one question about the county count specifically. And I'd like everybody in the room who's been to Bloomsburg in the last 5 days to raise their hand. Does anybody know what the transmission rate is in Bloomsburg? Very high. So those numbers that you're putting up are not correct for this kind of community, where people travel between counties that are high risk. So Bloomsburg is very, very high. I'm wearing my mask tonight to protect the people who are not vaccinated because I have been in crowds of unvaccinated students in a very high transmission area. So if you can consider doing that, making a mask mandate for the community to protect the most vulnerable, i.e. our children who are not able, or we can all in Montour County for the next, semester. So thank you.
Thank you.
I'm Ciccarelli. I live at 51 Maple Street. I have a kid in the school district and 2 that graduated from here. Thank you to the board, for your decision. I think it's wise and took a lot of guts and a lot of research. Appreciate it. Also, thank you for always answering my emails. You're good folks. I want to leave a few facts, not emotions, about mask wearing. I'll read them to you. N95 masks filter 95% of particles that are 0.3 microns in diameter. Can anyone answer the diameter of the coronavirus? Is to be 0.125 microns, less than half the size of the largest particle, of the smallest particle, rather, that an N95 mask will filter. I wonder if any kids here wear N95 masks. Unlikely. Vertical and horizontal airflow from masks isn't stopped. In a recent study, 624 of 714 people wearing an N95 mask left visible gaps when applying their mask. So you got a crowd of kids walking down the hallway. They're all sporting their masks. 1 of 10 is probably an N95. The rest are just, it just goes right through. And they're all breathing and coughing, and germs are going up and sideways, and everybody's running into them. That's if they wear a mask. If they don't, they can cough into their arm. Symptoms of mask wearing. Dyspnea, that means shortness of breath. Hypoxia, that means the oxygen and carbon dioxide exchange rate is off in favor of carbon dioxide. And what happens when that is off is hypercapnia, which is too much carbon dioxide in the blood, which leads to metabolic acidosis, symptoms of which are nausea, vomiting, fast breathing, and lethargy. Great for students and athletes, I might add. Sorry for being a jerk, but I'm opposed to mask wearing, and I love your decision to not mandate it. Thank you.
Thank you. Anybody else? Okay. All right. Next order of business tonight is our Section 5 on a presentation, and we have the Met's Food Service. Turn that over.
We have Bob here from Mets, and we also have Andrew here, and they're going to be discussing the food service program and what they have done in the district for the last 4 years, working on their 5th year now.
Starting our 5th year, the 2021-22 school year. I'll ever be. So about me, I have been a resident of Bloomsburg since 2004. Became a team member of Met's Culinary Management back in 2017 to take this job here in the Danville Area School District, where I left a career with Perkins, where I was the general manager for 15 years of the local Danville Perkins. So I knew the area well, and I always wanted to come back to Danville to work. I'm honored to be the leader of the program since the beginning of our partnership, as we said 4 years ago. I'm also a member of the Patient Family Advisory Board at Janet Weiss Children's Hospital and serve on the Bloomsburg Community Friendship Meal Advisory Committee at the Wesley United Church. My wife and I have 4 beautiful children, and I look forward to continued success in the coming years. And here they are. Myself and my family, just to get to know who I am and what I'm doing here, okay? But we take part in when Danville had their first trunk or treat 2 years ago. It was a rousing success, and my family's pictured holding the welcome sign. My daughter on the right, my son on the left. My daughter with the little Jurassic Ranger hat on, passing out candy, and that is my oldest daughter as the T-Rex with her cat in the cage in the back of our van as our Jurassic cat. A little bit about my company. We're a family-owned, family-driven company based out of Dallas, Pennsylvania, so only an hour away, but we are involved in 143 K-12 public school partners, 20 states up and down the eastern seaboard. We're the top 50, number 12 in top management company, contract management company. We manage 7,073 of our own employees, and we also add on an additional 1,500 district employees throughout our accounts. Of our brands that we have are Chick-fil-A, TGI Fridays, Ruth's Chris, Dunkin' Donuts, along with the Mets Culinary Management and the Mets Environmental Services side. And there you can see where we are in the Eastern Seaboard, pretty much nearly every state with, and I can't really read, but if you see the red dots in Pennsylvania alone, I think it's 132 dining service contracts. So, thank you. Our advantage is we're a privately owned, regionally based partner. We provide operational expertise. We offer a competitive financial program. We're a chef-driven, restaurant-inspired program with 100% trust and financial transparency. One of our great accomplishments in the district has been our guest student feedback program, where we, myself, some administrators in the buildings, principals would select some student committees, some parents and teachers to come and sit where we get some feedback. That would provide us to enhance satisfaction and develop positive interactions. And I apologize, I got a little bit ahead of myself there, but I'll see, I think that's coming up next. So we do meet, myself and Pam Burrows from administration. We will go out and we actually talk with our students and teachers and find out what they're saying about us. Some of the feedback we got from our middle school student advisory, and believe me, they have a lot to say. You know, but for some examples, they wanted to know, since COVID impacted the operation, it was important. Again, I'm sorry, got ahead of myself. We got back to using, can we get back to using the 5 compartment trays? But we said with the COVID mitigations last year, we wanted to, everything needed to be packed in single-serve individual items. And as Dr. Boyle mentioned, we will be getting back to more of a regular service this year. Very important part of this, as a note, it says the compartment trays were implemented district-wide in 2019, saving the district a disposable cost of an estimated $11,389 yearly. And that cost is directly attributed, I believe, through the students of Liberty Valley and the high school who were very active in bringing this problem to the forefront and bringing it to their administrators who would get together with them. And I do believe they came here at the school board meetings and expressed their concerns for it. The school board took action, and that's why we were directly able to impact the environment positively as well as financially. Liberty Valley, some of the meetings is they love our healthy choices. They like everything, not enough meat on their tacos. But, you know, my daughter agrees with that. But But at that meeting, we reviewed the guidelines from the National School Lunch Program and what makes the school breakfast and lunch requirements work. We also discussed how the COVID has impacted the program with the hopes of the normal service for this coming school year. One of the achievements that I believe we brought to forefront was the negative student balance summary. And as you can see, it's been consistently under $2,000 the past 5 years, but last year was a $14.03 negative balance from students. And I think that's pretty significant because if you remember, I think 2 years ago when Wyoming Valley West School District, a little bit north of us, the school board were suing parents. They had negative balances in excess of $20,000 that they had to cover with their general fund. So when you have negative balances, the general fund must zero it out at the end of the school year. And our team has been very diligent in communicating that from our cashiers to our students and consistent communication with the parents. Because of that, we've been able to, from 2006 to 2010, the general fund was forced to account for $267,822 in accounts payable for salary and benefits because of lack of funds in the food service account. During the 2021 school year, $100,000 of the cost was transferred back to the general fund due to a strong performance and bottom line excess. We're anticipating that the remainder of the cost could be accounted for the food service during this year from the 21-22 school year. We're very hopeful that we can pay that balance right back to the general fund with a successful year. The financial numbers about the guarantees from the Metz Culinary Management to the district and some of the actual performances. And as you can see, we were getting better every year in our actuals, and our total guarantee over the 4 years was $402,879, and we've achieved a $285 above the guarantee. So again, implementation of the district-wide reusable compartmental tray saved at least $22,778 in disposable cost, including the cost of additional, not including refuse. Reconciliation of the food service fund versus the general fund was $267,822.01, and more added value. There was a grant that Dr. Boyle wrote that she asked for some input from Bobby Ely, Pat Burrows, myself a little bit, so we were able to, she was able to secure a grant of $49,005, and thankfully that our director of maintenance was able to secure the bids and get everything happening, and we have, go ahead, brand new cooler as a result in our middle school. This is the nearly finished product of it, but if you work in any kitchen or any restaurant, there's nothing like a brand new shiny piece of stainless steel. It's like heaven. Thank you. Go ahead. We also had a pretty seamless COVID transition. March 13th, I was called into the office to say, we're closing school for 2 weeks. How can we feed the kids for the next 2 weeks? So we all know what happened since March 13th, and I think we were pretty successful in providing meals to the students and the community for the most part through all summer last year, continuing through the cyber classes and the hybrid model this past school year. So these students were guaranteed food, and we were pretty successful to make a pretty seamless transition with that. Here you see some of our staff members all stacked and ready to go outside the middle school, where we had a non-congregate pickup. Cars would drive up, we'd hand them their food, their meals, and drive away, and we did it in a safe environment, so we feel we did it very successfully. We also were able to, through some finagling and discussion with Giant Market, they were helping us with some small donations to get this food service transition started, such as the paper bags you see there, which, because we do have a high regard for environmental impact. While other districts were handing out food in plastic bags, we were using paper, and Giant respected that, wanted to help more, and we were able to secure the first was a $5,000 grant from Giant to assist with the food and distribution specifically for our students on the non-congregate setting where families would drive up, and then another grant of $6,000, I believe, later on in the school year. So it's been very successful, and I think that the whole district, we did a great job, the staff and administration, in making sure that students were always fed and never missed meals. So I thank them for that. Thank you. Has any questions about food service?
Does the board have questions? I want to thank Bob and Andrew and Metz for working with the district. You've provided good service to the district and are always willing to have conversations and give feedback and willingness to change anything that we request, and last minute, like the COVID situation. So thank you.
Thank you, Bob. One quick thing. Do you happen to have any appetizers or anything sitting around? I am kind of hungry. You showed me all that good food. I can't help it, but my stomach started grumbling. I had to turn my mic. All right, thank you. I appreciate that. Thank you.
I have to say the cooks for the Mets service have some really creative ideas for sandwiches and specialty things that they do. So in the administrative office, we enjoy going over to the high school to get our lunches. Reasonably priced and delicious. So thank you, Bob. Now, one more thing. I see Mrs. Morgan there. Do I have Chloe or a couple other students that would like to come talk and give us the information on the SPM Carnival? And I think there's something else you want to do, right, Chloe? Okay, come on up, kids. Use the mic.
Hi, I'm Chloe Hoffman. We'll just start by introducing ourselves. So, I'm Chloe.
Hi, I'm Lauren Hawkins. I'm Gabe Benjamin.
And this is our advisor, Miss Morgan. So as a couple of you know, if you don't, we just recently held an event at the Washies baseball fields, is specifically in memory of Jason Gordon. We did a baseball carnival. So I originally had this idea back when I really got started in SPM, which was probably about a year ago, I'd say. So I've been wanting to do this, and we finally got together to do it. So what we did was we held home run derbies for the younger boys, and then we had an adult softball game, which was really interesting, really fun. And then we had a little bit for everybody. So we had a carnival for all the younger kids my age. I played some carnival games, and we had food and a huge basket raffle. We had a lot of donations, which means the world to us. Every single basket that we had at our basket raffle was donated by the amazing community that we have, our friends, and some local businesses donated some really, really amazing baskets beyond what I could have asked for. And we had Middlesworth donated a bunch of chips to us, Wise's, Giant, Sam's Club, all donated. Rita's donated. A daycare in southern area donated. So we were really grateful for all of the help and just support that we have. Like, it's just nonstop support, and we can't thank our community enough. So the main reason I'm here is to give the total of how much money we raised. This was our biggest event yet. And we're just beyond grateful. So the amount of money that we raised, and this money does specifically go to the Jason Gordon Memorial Scholarship Fund. So we raised $4,017.75.
That's amazing.
So as you can tell, it really means a lot.
Thank you guys for listening.
I'm sorry. I just want to put out there how proud I am of these guys and our graduates that started SPM a year ago. I think they came to you guys and said, we want to do this. And so Gabby, Laura, Lindsay, the Cashners, Brady, I mean, there's a slew of kids that graduated that came back and came to the carnival, helped out, so they're still a part of this. But the three in front of you did so much for this. I signed paperwork and that's about it. So it's them, guys. Like, your community has amazing, amazing kids. I'm blessed. Thanks.
Thank you, kids. We really appreciate
Thank
your
you, guys. You did a
initiatives.
phenomenal job Saturday. Thank you. Okay. Next order of business tonight is our Science and SEL piloting program. Over to Mr. Bickhart.
All right, good evening, everyone. I'm John Bickhart. I'm the Director of Curriculum. I'm going to lead this off and hand it over to Mrs. Willoughby. I think this leads right into where we're at. So the district is committed by 2022, 2023 to having social emotional curriculum in all 4 buildings. It is a necessity, is as important as the other 2 things up there of science and math. We need to be continuing to work with our students on this important topic of ensuring not only their academic well-being, but their social and emotional well-being. So with that said, we're going to begin this by piloting. And what that means is certain classes in each of the levels will be working towards this. So we are making sure we, understand what we're doing, how we're handling it, and that it's effective before we do a full implementation across the district. So I'll turn it over to Mrs. Willoughby.
So hello, everyone. I'm Mrs. Willoughby. I'm the principal at the Danville Primary School. So what we did was we formed a SEL committee within the building, and actually in every building. They all formed their own committees. So through this committee, we began to assess and look at different curriculums, different programs that were out there. So what we've concluded is that this wonderful curriculum, I'm going to grab a book, called A Little Spot Of. And what this does is this author goes through different emotions and things and identifies emotions for kids in a friendly, hands-on manner. So along with the books, there are fluffy little emotion markers that the kids can identify with, and it's very neutral and friendly for our elementary students. So our plan, of course, is to develop and create our own lessons, integrate it within our curriculum, and use our intervention specialists and this SEL committee or team that we have at the school to go about this. So the teachers already are given time within their day to implement the social emotional learning. So at the beginning of the day and at the end of the day, teachers are given time to address this. And the goal ultimately is for all teachers to have the kits in the classroom and the resources available to them. Okay, Mr. Gum.
Okay, thanks, Amy. Mine is clearly not as cute as Amy's with the little green little emoji over there. Okay, so at Liberty Valley, we have chosen Responsive Classroom as our curriculum for Liberty Valley. So again, we are piloting. We have 4 classroom teachers and our intervention specialists currently in the midst of a 4-day training. They're taking the elementary core training course. They started today and they will finish here on Thursday. So our hope is that little by little this year, as they pilot and do some things in their homerooms and their groups that they work with throughout the school day, they'll be able to share some things with their teammates, with their colleagues, and just again, little by little, start doing some responsive classroom, we call it RC, classroom implementations throughout the course of a school day. So one example of that is just a simple morning meeting. Some of you who have children that have come through Liberty Valley know that we have homeroom, and during that homeroom time, they can just have morning meeting time, a time to talk, work through some things. Some students can get some things off their chest, relax, and then be ready to go for the remainder of the day. And this program helps teachers and helps students through simple things like having a morning meeting. One thing, kids come in from recess sometimes pretty keyed up. Last year it was kickball. Kickball was the really got the kids spun up. Some were good sports, some were poor sports, but we worked through that. But the point is we had a little bit of quiet time coming in after the recess time, and that's going to help them get focused and get structured for the academics and what's ahead for the remainder of the day. So again, just a quick recap, we have 5 of our personnel at Liberty Valley in the RC training. It's happening this week, and then from there, little by little, our hope is to have that fully adopted for next school year. And I'm sorry, I lied, one last thing, is all of our teachers are getting, it's the 3rd paragraph down, the first 6 weeks of school, and it's just more of an introduction where we're going to be reading some things through together, having some professional learning communities, some teams working through some of the concepts that way. Thank you. And now Jess Knoll from the middle school.
So to echo what Mrs. Willoughby and Mr. Gump said, at the middle school, we will be implementing positive action, and it's going to be piloted by 4 of our teachers during the current school year. We will have our training later this week during our professional development days. The core teachers who are part of our team will be provided with a grade level kit, which is very hands-on and interactive. And along with supporting them, we will have our guidance department and our intervention specialists who will help guide our teachers through this program. And along with Liberty Valley and DPS, our goal is to roll this out next year across all of our classrooms.
Right, at the high school, we're really excited that we have Mike Mays at the high school with over 30 years of experience in our guidance staff that really helped us last year implement this throughout our building. So the curriculum was rolled out and it was embedded in classes. So for example, in psychology classes, they talked about a number of things with Mike Mays and our guidance staff there, including stress, relationships, decision-making, proper behavior, how to deal with people who don't have proper behavior, and so on and so forth, and how to facilitate good positive relationships, what those look like and what they don't look like. Faculty trainings, we continued faculty trainings throughout the whole entire the school year. It was important to us to a lot of our professional development days and a lot of our faculty meetings to be dedicated towards how do you help students on a day-to-day basis. Part of our day, at the end of the day, we continue our last period for another 23 minutes. And during that time, it's really about making connections with kids. We have a social emotional learning time at the end of the day, and it's dedicated towards that. Teachers walking around, talking to kids. It's not just a homework time. It's, you know, hey, how was your day? What does your day look like? How's your relationships going? How's sports going? What do you need help with in school? So on and so forth. And then we were able to, last year the board did approve a personalized learning teacher, which has been important to some of the kids who are struggling in almost those in-between students who might be coming back from placements, might be going to placements, might be struggling academically. It's been something that's been important to us moving forward. It's been a great program, 100% success rate last year in graduation. So all those kids that were in there made it. You know, some of those kids might have attendance issues and we credit deficiency. So we work with Mr. Johns and Brett Sample about getting them and earning them credit so that they can graduate. So we're appreciative of the board approving that position last year. And we're looking to, you know, the last bullet there, just continuing to expand that. You know, like I said, we did embed it in our social studies classrooms. We continue to embed it in our English classes. The first professional development day that we have this year, where again social emotional learning is a focus. So, you know, as you can see from all the people here, it's been something that we've really dedicated a lot of time towards, a lot of energy, and we feel it's important for kids. So, thank you.
I think the final thing before we go into science, I just want to say is, if you're looking at that, you're going to see we've chosen each building to do something a little bit differently. And I think that's important, because for this to work and for it to be effective, there needs to be complete buy-in from each of the schools. So I commend the principals and the teams that have worked on this in the middle of a very difficult year last year. They stayed focused on this goal, and we're beginning to move it forward. So before I go into science, any questions on SEL from the board? Okay, so the next piece is two quick things I want to share, and I think it is important, again, for the community here. Anytime we look at curriculum changes or we do anything with curriculum, we bring it to the board. It comes to this group. It comes, you know, beyond our discussions with teachers. It comes to the board level, and we have that discussion regarding, is this appropriate? Materials are available for review. Nothing is done without that. So, and I also think this year is a difficult year to say, hey, we're doing a lot of brand new things when we're still just trying to get back, hopefully, to a sense of normalcy in traditional learning as the year progresses. We did, though, begin the conversation about science and social studies. I've been in the district 18 years now, and there's been great changes that have come in that time. But I think one of the things we are looking at, and I did not put a lot of information here, but I just want people to hear, is we recognize that while we have great offerings from 6 to 12 in our sciences, I'm concerned on what we have K to 5, and the focus directly on science content beyond just nonfiction text. So we are going to pilot. We have 2 third grade, 2 fourth, and 2 fifth grade teachers who are going to look at the Inspire Science curriculum. And just a few things that are important about this is it's all about investigation. It's all about science inquiry. It is also about reading and science facts and all that. Like, if you think of old science, it's a traditional model, maybe as Mr. Gump and I have said a little bit, but we're still looking at in-depth learning, inquiry. Most importantly, what I want to see over the course of the next few years is a true scope and sequence when it comes to science instruction K to 5. So we're beginning this process. There is, again, information available for anybody to look at as we move forward. Questions on science or where? And I guess one thing I should add is if it does go well, we are hoping for a full implementation the next year. Mrs. Willoughby and I've already discussed a little bit of looking at the K to 2 teachers so they can see what